I noticed a place on my arm that was it was a red mark that bled every now and then it has started getting bigger. So I just decided that there was something not right about that. So that's why I decided to make the appointment to come here to the dermatology department.
There are 3 different types of skin cancers: basal cell and squamous cell carcinoma, which are the non-melanocytic skin cancers, and melanoma, which is derived from the melanocyte.
I came in and a resident came in and he looked over me and he looked at my arm and he said, okay, well that might be just a basal cell cancer.
Most basal cell and squamous cell carcinomas are relatively easy for dermatologists to evaluate. The cure rate is very, very high. Melanomas are a little tougher. Melanoma is the great masquerader. It's very difficult when melanomas are early to distinguish it from just a common mole.
And then Dr. Rabinovitz came in and he did a thorough investigation of my whole body.
In the past, we've used our eye, and our accuracy is about 60% with our eye in terms of distinguishing an atypical mole from a melanoma. We use a little handheld device which is called a dermatoscope. When you put alcohol in the skin, it makes the outer layer of skin clear, so you can see patterns that you can't see with your eye. And it increases our ability to diagnose a skin cancer of a melanocytic derived neoplasm from 60% to almost 80%.
He said basically the same thing, not anything to be worried about, but we still need to do a biopsy and have it checked out.
In those instances where we can't diagnose with the dermatoscope, we biopsy.
And at the same time, he said that they got a new piece of equipment that can actually look deep into the skin and get a better picture of what's there.
It's called a confocal microscope. It's actually a laser beam which, when it hits the skin, gets reflected back into a computer screen where you see the layers of the skin live. It's almost like virtual pathology. Now we go to from 80% to 90 to 95%.
It was not painful in any way. You just had to sit still while they did the pictures.
We're seeing patients now to be evaluated for lesions where a patient might not want a biopsy in terms of from the scoring point of view, or a lesion that's difficult in terms of the diagnosis.
It's a relief knowing that it's probably not anything major. I would say absolutely make an appointment, come here and see one of the doctors.